So, Dr. Lev, early on in the war, can you talk about your involvement and then the connection with Global Care Force?
Actually, my connection with Global Care Force started in early 1992 when my parents was the first time my father and mother was connected with the Dr. Gary Morse through the Heart to Heart Foundation. They was providing medical care support for Ukraine. That Dr. Gary Morse, he took a huge cargo plane right to Moscow, and my parents meet them in Moscow and actually took the humanitarian supplies for medical care, and they bring it by train to Kiev. And we understood that our Ukrainian government was focusing on the rebuilding as roads, bridges, communications, water supply, electricity supplies. And actually they started to recover the primary care centers. But it was a gap with access to medication and access to healthcare professionals. And the beauty of Global Care First that at this right now in 2025 is still one of the organizations who continue to send volunteers as a healthcare professionals to the-occupied areas, and we are working where is our help and need is most important, most demand.
So, give me your view of these areas, what they would look like, what they look like today, what they would look like without Global Care Force.
From some of the villages, they need to take about 2 hours to get to the closest pharmacy to get to the medication. They need foundation. Of course, Ukrainian governments try to support these villages, but we are working in that very complicated areas where is a very hard access people to get this medical care. And without Global Care Force, without our volunteers, it would be very hard to these patients. And of course, we talking about the chronic patients with a chronic disease like diabetes, hypertension. And you couldn't just go once and just give one tablet for 1 month. You need the life treatment medications. They need continuously to take care. And here it's our legacy as a Global Care for to Ukraine and advocacy for Ukraine that we are right now stay here, but also to supporting people on that area that the essential need our help.
What's a typical day like in the field for you?
We set up clinics every day. We have 2 clinics. We set up our clinics. We organize our registrations, and we go there for triage. Where triage is where our nurses, volunteer nurses, working to make sure that they took all of the vitals, and then patients go to our health provider. But also, 1.5 years ago, we also starting as providing trauma care. We in our team we have, beside healthcare professional as a nurses, PA and physicians, we have trauma care specialists, because trauma care is very important nowadays. But during one day, we are taking care about 100 patients because we have 2 clinics. And every month we have 10 clinics in a row, almost 1,000. You could just up to 1,000, but usually we will say less. But with the helping and saving life of one patient, you could change his life. You will definitely change a life of the family that who taken care of these patients, and you will change life of community and of Ukraine. And with one of the personal visit, personal contact with one of patient, you could bring him hope, joy, and love.
Dr. Lev, let me talk about your responsibility because you're working there in the field with these patients. You're working with the volunteers. Um, it's an awesome responsibility to try and care for these patients, nurse them back to health, but you also have that responsibility of caring for these volunteers. It's a war zone. It's never easy. What are some of the hurdles that you have to deal with on a daily basis?
First of all, is a safety measurements in the all of the aspects is a health safety, safety itself, because we need always months and ahead, week and ahead, day and ahead. And actually, when we are field, we check in the situations. We spoke with the local authorities where we will be operated, that it will be not will be harm both our volunteers and the people who will be providing care. We make sure that in each of our location we will have if it's we stay hotel is a bomb shelter, when we're in a location where we could as a place we could use shelters. We have safe protocols that we follow of this protocol in the field, and we always need to control the situations, and if necessary we just leave everything and we'll just go according to the protocol.
Great. Thanks so much for talking
Thank
to
you.
us.